Let me know. Videos and Voices of the Unheard. We are 2V Stream, a global youth media initiative, and you're keeping it ugly with me, Joe Ugly, and Dr. Tamiko Jackson, DR, Doctor, as in MD, pediatrician, as we discuss the different illnesses of our youth. Welcome, welcome, Dr. Jackson. How are you?
I'm good.
Come real close to that mic
Oh,
so everyone can hear you.
that's right. I'm good. Happy to be here. Be back in the studio with you guys.
The space of ugliness.
Mm-hmm.
Yeah, look, it's been a while. I mean, you used to have a show on here
Mm-hmm.
where you discuss many things, but tonight definitely what we want to discuss is a lot of illnesses that are in our community, and I mean black community, that really affects our kids. One of the diseases that is out there with blacks in particular is sickle cell. Now, when does that show up as a disease?
So sickle cell affects mostly people of color,
Mm-hmm.
BIPOC, because you see sickle cell in Latinos, people of African descent, and we know that with the diaspora,
Mm-hmm.
you know, people from Africa are all over the Caribbean and
Mm-hmm.
in South America, where we have majority of our Latino people. So Latinos and black people of black descent, right?
Mm-hmm.
You find out you have sickle cell I'm going to use the state of Connecticut as an example.
Mm-hmm.
We test all newborns for sickle cell.
Oh,
So
okay.
if you were born like within the last 30 years, you were tested for sickle cell.
So therefore, don't have to wait. A parent don't have to wait to find out if their child has sickle cell because you get tested at birth. Is what you're saying?
Right.
Okay.
But also, the mothers are tested for sickle cell trait and sickle cell
While she's pregnant.
Yeah. So if
Okay.
mom has sickle cell trait, they're gonna test the father and say, and then go over what are your chances of having a child who's going to be affected by sickle cell.
Mm-hmm. What does sickle cell actually look like within a child? Go ahead.
So
Symptoms I'm looking at.
in a baby, it's swollen, painful hands and swollen, painful feet. It's called dactylitis.
Okay.
And that's usually the first sign of like a sickle cell crisis in a child.
Okay.
As they get older,
Mm-hmm.
they start to have sickle cell crisis in their backs, in their knees, in their chest.
The same swelling.
Swelling, inflammation, pain, because the blood can't get through the vessels, so it causes what we call ischemia. So the blood can't get through, so it causes ischemia, tissue dies, inflammation, a lot of pain.
So, is this well? They don't have a cure for this right now, but it's treatable.
Oh, they have a cure.
They do have a cure.
It's called a bone marrow transplant, and they've done it on a few people.
Mm-hmm.
So they exchange your marrow for marrow that does not have the gene for sickle cell.
Mm-hmm.
So then, if you don't have the gene for sickle cell, then you're not going to produce cells that will sickle. So they do a bone marrow transplant
In a baby.
I don't think they would do it in a baby. They probably save that for people who probably have more severe of a course.
Okay, so here's what I gotta ask then. Okay, you say it's tested when parent at a newborn, correct?
Yes.
Okay, so newborn is tested for sickle cell, and so now the parent is keeping an eye. It's advised that the parents keep an eye on the child to see if any of this stuff inflamed. Because I want to know, what age do you say my child might need a bone marrow, or is it done in children?
It's done in children for many other illnesses. I'm not exactly sure what will preclude a child from getting it, if it's age or if it's the level of disease that you express. So I don't know those specifics, but I do know that a bone marrow transplant will cure you from sickle cell disease.
Oh, okay.
The treatment, though, is basically fluids, pain management, blood transfusions, rest, a lot of different things that they use. Antibiotics, certain drugs called sulfonylureas. It just depends on.
Oh, okay. Uh, Moving on, I'm speaking with Dr. Tamiko Jackson. Here, she's a pediatrician out of New Haven. Uh, Autism.
Autism.
Bring it to me, Todd.
So, autism is a communication disorder.
Okay.
So, it doesn't mean that your child is slow. It doesn't mean that your child's going to have an intellectual deficit. It means that they have a condition that will prevent them from communicating like anybody else would.
Mm,
And I say that because children with autism, I don't like to necessarily say there's something wrong with them.
right.
They just communicate differently.
Correct.
And we have to find that best way to communicate with them.
Mm.
Autism is not caused by vaccination. It's not.
Yeah, that's a big one. You hear people say, "Oh, I don't want to give my kids vaccine because I don't want them to end up, with autism." So you highlight, and I'm glad you highlight that it's not because of a vaccination. But go ahead, you were saying.
No. If your child is going to be autistic, then they're born that way.
Okay.
So it's not something that the parents have done or what they haven't done. It's not something the doctor did or what the doctor didn't do. You're born with that. And then as the child gets older, you start to see signs. And the reason why they tried to connect it to a certain vaccine was because when the child is a year old, that's
Mhm.
when you expect to see certain developmental milestones being attained.
Mhm.
You're looking for walking, you're looking for talking, you're looking for a lot of different things. And it's really, really clear at 12 months. And at 12 months, that's when you got the MMR.
But what about kids who just develop later in life? Do they necessarily have? Because I know some kids didn't start talking until uh, 18 months. Well, more like 2 years. 24 months in, almost 24 months that they really started saying their words.
Mm-hmm.
But is that necessarily a level of autism or?
No, it could
Okay.
just be a language delay, speech delay.
Okay.
Um,
But this is sometimes misdiagnosed as autism, isn't it?
no,
Oh, okay.
because you get evaluated. There are things,
Okay.
and there are ways that children with autism progress developmentally, and there are ways that kids who simply have just a speech delay will progress.
Okay. But
But then again, and autism is a spectrum. So
Okay.
all the way to my left are going to be children or people who you might not know they have autism, and all the way to the right are nonverbal, maybe, it seems as if you can't get to them. They're maybe the hardest to reach on the spectrum.
uh, what would you recommend as far as to a parent who have autistic child for, I mean, just for survival?
That they make sure that that from day one they have a relationship with their pediatrician, because the pediatrician is going to let you know if they notice these developmental delays not being reached, right?
Mm-hmm.
And then getting the help needed, because the more intense the help is and the services are,
Mm-hmm.
then the higher your child will get as far as potential. So it's like if you don't pour into what a child needs, whether it's autism, love,
Mm-hmm.
discipline, if you don't pour that into the child, then the end result is not going to be to the potential that it should have been.
Okay.
And so make sure that you work with your pediatrician.
Pediatrician. In our community, now you've been practicing medicine now for at least 15, 20 years at least. How long? 27. She's doing the math.
24 years.
24 years. Wow. You know how busy she is that she don't even stop and say, I've been doing this for how many years, She just had to stand there. And she's sitting there talking about something. But let me see. It was, she's counting on her fingers, moving her toes around in her shoes, doing a full count. Okay, for 24 years, changes in medicine that you have seen towards pediatric approach.
I think that
especially in our community.
People are more willing to understand that not every behavior is a bad behavior. So
what do you mean?
Years ago, a child with autism, they would say that they were crazy
Mm.
or that they had intellectual deficit, and they would
Mm-hmm.
just put them in an institution, not really work with them, not really get them to the potential, right?
Mm-hmm.
But now we understand that there is an autistic spectrum.
Mm-hmm.
We understand that every family is different. So my practice and my culture is that every family is different. So there's a different culture in every home. So when you come into my practice, it's not like everything fits into the same hole, right?
Mm-hmm.
Everything's in the square box. Everything's no. Everyone is different, and so I have a relationship with every family, and we usher the patient, the child, through childhood together.
Mm-hmm.
I think that the um, pediatrician no longer is an older white gentleman.
Mm-hmm.
I know
As you have proven.
Right. There are
Yeah.
young women, black women, white women, Latino women, all kinds of um, LGBTQ. We're inclusive as far as pediatrics is concerned. We have
Mm-hmm.
everybody.
Mm-hmm.
So I feel that our um, the panel of options for families is great, and you could really pick and choose your pediatrician with how can I work with that person? Because you have to work with the person, you have to trust them, and it goes both ways.
Up until what age would you say would you keep a patient? You
Oh,
know,
22.
22. Wow, that's a long.
Because they're still adolescents at that point. They're still within my purview. Mm-hmm.
Oh, okay. So you're like, oh, that frontal lobe is not developed yet. You need to come in here. So they turn 23.
And then I help them find somebody.
Oh, okay. So you pretty much have people pretty with you.
Their whole childhood into when they begin adulthood.
But I'm talking about you personally. You have people who you probably just watch all the way because you've been doing it for 24 years. You've been watching people grow all the way. Now, by the way, let me let you know her practice is New Haven Pediatrics, right here in New Haven, Connecticut. You did have a second office also.
So when I have mental health on site now, so when I decided to do that, and I have like a diaper bank, I have all kinds of services. I consolidated and I got a bigger office. So I'm on 419 Whaley. I have a big marquee that says New Haven Pediatrics, storefront.
Let it be known. She's in the 419 Whaley. That's that's the building over there by Ellsworth.
I'm next to Diamato's.
Oh, okay, right. Next to the models. On the first floor.
Storefront. Street.
Isn't it an office building?
Street level.
But isn't it an office building? Though?
I got 2 entrances on the Whaley. I got 2 bathrooms. I mean, I got moving on up.
Wait a minute. You're no longer in the office building, or you're in the standalone?
No, I'm in the office building on the first floor.
Oh, okay. Yeah. All right. She say storefront.
And I have a marquee.
The way she's
a marquee. A marquee. Next level.
Speaking of Dr. Tamiko Jackson. I gotta say it right. Full disclosure, Tamiko's like a sister to me. We go back. We have history.
Mm-hmm. Not that type of history.
I know you definitely got to clear it.
Let's clear that.
No.
History.
No, I'm glad you clarified that because next thing you know, we got to clear it. People run with things.
Exactly.
Next on the New Haven Independent, Joe Ugly Tamiko. How long has this been?
Well, not the New Haven Independent. But
I know. I'm
Haven
just
Gossip
joking.
Club.
Gossip Club, right?
Blindness and deafness in pediatrics.
Where's he getting these topics?
Where does that? Why?
It's just random.
Now, how is it random?
These are very much so.
I love it.
Yeah, well, okay.
They're on point, right?
Made me a little concerned here. She's like, well, this is random. No,
it's research.
I'm trying to cover as much as possible because for the short time that we have tonight. And I want to cover as much to help the audience understand
absolutely
things that they should be paying attention in pediatric form.
Okay.
And blindness and or deafness in our community, especially with kids. I take it that you get tested for blindness or deafness at birth or something today?
So
or how is that done?
At birth you get a neonatal hearing screen. So everybody gets a hearing screen. So we do test for congenital deafness. That doesn't mean that.
Now, is that kids who are born is that a pediatric first, or is it at the delivery?
What, the hearing test?
Yes, the blindness
The,
test
the hearing test is done in the nursery
at there. Okay,
at birth.
Okay, so what about the kids? Are kids still being born at home or
Yeah,
midwives or
there's
so?
some. Yeah, there's
Okay.
some people are doing that.
All right. So how is the blindness and deafness?
So we don't test for blindness.
But okay, deafness.
The hearing screen that tests for hearing loss.
Mm-hmm.
That's done at birth, and
Now that's interesting. You call it hearing loss.
and it could be deaf. You could be deaf.
Yeah, but when you say hearing loss, I got to pause here. I got to be real detailed here because hearing loss is like, well, you didn't have it in the first place, so how you lost it? You just got here,
Or congenital deafness, yeah.
Okay, go ahead.
And all of that, we test for it, so we know.
Okay.
There's a Connecticut School for the Deaf in the Hartford area that I have patients up this way who are deaf, who go from New Haven area all the way there. It's a great place. Really, really, I love how they teach.
Okay, so they test for deaf, for hearing loss or such. This is after birth. Is this mandatory?
Yeah, it just happens. All the babies get it.
But is it mandatory? I know all of them may get it, but I mean, because I want to know for like midwives and such who decide, well, I'm just going to have my baby, go through a midwife situation, and then, decide to do the old
I'm sure the midwives, no. So the midwives are not like, the
old school girl
woman walking with the cane, come in your house. No. They're
throw the kid against the wall to see if she's gonna cry.
No. They're trained just like everybody else who are delivering the babies, and they come to the house if it's gonna be home care. They do. I'm sure they do everything because when I get kids that are born at home, they come with everything.
Oh, okay. So, all right. Now you have a kid that have deafness. So walk me through the process of working with a parent. For a parent who have this and who may be listening and saying, I want to know as much as possible. That's right. I'm quite sure some parent may or may not look into details about loss of hearing or hearing. So just walk me through a little bit. What is that like?
So you mean when a parent has been notified that their child may have be deaf? So, as with anything, when we notify parents of an issue, you offer what a solution would look like.
Okay.
So, for an infant, then you make the referral. They go to all the specialists, and the parents there from the beginning like that. If it's a hearing loss, like so, say the child is born hearing, gets an infection like meningitis or something that will attack the hearing centers, then that's an acquired hearing loss from an infection or what have you. You just follow the process with your specialist. We have specialists and parents who. No, I'm not gonna. I will say it like this: all parents want their kids to be at their best. I haven't seen any parents who have said, "Oh, my kid has this, and I'm just not gonna, I'm not gonna follow this specialist. I'm gonna go do my own thing." I haven't seen that type of craziness. For the most part, all parents want their child to be their best.
For the most part.
For the most part.
Okay. And siblings having to deal with a kid,
siblings,
a sibling. Go ahead. How do you prepare a kid for it?
Resilient. They're like, can the kid play with me?
They're
resilient, and they're probably the ones that are gonna.
And that's cool.
Learn the sign language, quicker than everybody else, because they're gonna probably have their own signs.
Oh God, there goes the secrets now. Oh, really onto something now. You got a kid who is going to be working the secrets with a sibling against a parent. Oh my goodness.
Exactly.
Oh my goodness. Asthma and allergies.
So
let's touch.
Asthma is it's a lot of asthma in New Haven.
Now, what is there?
Is there a
rise? I'm sorry.
I was gonna ask: is there a study that explains the root of asthma in New
Oh yeah,
Haven?
oh yeah. So New Haven, we know we have old buildings.
Right.
Okay.
We've got mold.
Mhm.
We've got rodents,
Mhm.
cockroaches,
Mhm.
Mm.
pollution,
Mhm.
and also in-home factors like dust, cigarette smoke. Sometimes in some folks might not be able to um, just like socioeconomic issues that can
Cause
Mhm.
it.
lead to situations that um, would make asthma a little bit harder to control.
Mm.
So let's think about the mom who has to work, but works shifts where they're may not be home as much as they can because they're making ends meet, and siblings are taking care of siblings, right?
Mhm.
How will they be able to who is there as an adult to assess severity,
Mhm.
right? Or that they may need an inhaler.
Mhm.
That's an issue.
Mhm.
What about in slumlords? We have slumlords where there's mold,
Mhm.
there's
Now what?
rodents, there's cockroaches,
Right.
and all of that can be a trigger
To
for an
asthma.
asthma issue.
Mm.
Have there been an increase in asthma in the last 25 years or so? And if
Oh,
so,
yeah.
any particular areas have you seen this?
I think pollution.
No, any particular areas in the city itself that you could pinpoint and say, well, kids who came from this area in a certain time frame, they may have asthma.
Well, we know that areas where you have socioeconomic status is on the more on the poverty side,
Mm-hmm.
that asthma is more.
Uh,
Because we know that housing quality is not as
right,
good.
right.
And that's a big issue.
Bumping off to allergies. When I was a kid growing up, everybody ate peanut butter and jelly. Today, you got peanut allergies. Was this always a thing, and we just found out about it, or is what's the deal with peanut allergies? I'm trying to wrap my head around this.
Yeah, I wish I knew, but yeah, peanut allergies are off the chain right now, and a lot of places are peanut free
Mm-hmm.
because peanut allergies are so severe
Right.
and fatal in a lot of situations. There was a young lady out west. This case, she was at a camp and she had eaten Rice Krispie treats
Mm-hmm.
all the time. There was a cross contamination with the Rice Krispie treat, and the last thing her mother heard was, "Mom, I'm sorry." She died.
Wow.
Yeah, peanut
Wow.
allergies are serious.
Here's the thing. I need to understand. I'm trying to wrap my head around this because, like I said, when I was a kid, everybody ate.
I love it.
Yeah,
Oh,
everyone ate peanuts. But is there something in particular that you noticed as younger kids that it started working, with youth? Is there something or is there a study out that show what triggered this thing with peanut allergies? Because I missed it. I've been looking
Yeah,
to
I
see
don't
what
know
triggered this.
I don't know offhand.
Or did they start
But-
preparing peanut butter different or having peanuts different?
No, I think that people just started paying attention to stuff a lot more.
Mm.
I don't think this is completely, out
Yeah.
of the blue.
Mm-hmm.
Folks just know a lot more. I think knowledge is better.
It's interesting that you said that because I remember reading that no one is written off as died of natural causes anymore. There's always something that happened. Even someone who goes down on death row, who go down, someone who is who they zap, buzz, inject, whatever, however you want to put it. That person is written off as a homicide because you die by the death. You die by the hands of another
Someone
human being. So so there's no such thing as death by natural causes anymore.
Wow.
That's an old thing. So maybe the peanut thing is falling into the same realm where we realize now that, well, little Johnny didn't die because of whatever natural causes. He just crib death. No, that's another one. SIDS. Is that thing still around? Is that still considered?
Unfortunately, yes.
Tell me a little on it.
So we really don't know exactly what causes SIDS, but we do know how we can decrease the incidence. No sleeping with your young baby.
Mm-hmm.
The baby should sleep in its own crib or bassinet. Not a lot of covers, just
But a lot of kids, not a lot, but I've heard stories of kids who in their bassinet or in their crib by themselves, and they still die of sudden instant
sudden infant death
death
syndrome.
syndrome. Yeah.
Yeah, we really don't know why. So we have to put babies on their backs when they sleep, not on their stomachs, always on their backs. Just with the onesie that they have on, no covers, no pillows, no stuffed animals, no toys in the bed with them, and no co-sleeping. Co-sleeping with infants can lead to not just sudden infant death syndrome, but it can lead to smothering your own child.
Right, rolling
There
over.
have been cases where parents wake up and they can't find the baby, and the baby is all the way at the bottom of the bed in between the sheet and the mattress,
Oh
where
my
it curves,
God, yes. Hey,
asphyxiated, or
hey,
between the mattress and the headboard, asphyxiated.
hey.
Because when you're tired,
Yeah.
and it's all that type of stuff can be prevented
Mm-hmm.
just by not sleeping with your child. And I know a lot of cultures co-sleep,
Mm-hmm.
but we know that the increased risk in SIDS and accidental asphyxiation is not worth it.
I remember when my other son, my biological, when he was born, one of the things that, first of all, 38 and a half hours of hard labor, then a C-section. We all were tired. Both her, his mother and I, we were tired as all hell.
Mm-hmm.
But we knew we had to do something, I had to put him, and then he would not sleep. Oh my God, he would not sleep. And it was, sleep deprivation was setting in like a mother.
Mm-hmm.
And one of the things that I did, me and my creative Trinidadian behind, if you may, I created this 18-inch, because I realized it was calm when he was inside his mother, and I don't know what the inside look. Well, I had an idea what the inside looked like because I told you it was a C-section, what her insides look like. I got a 18-inch pillow that was the exact size of his crib, and I put chipped up sponge in it inside the pillow. Yeah, I'm telling you, it was crazy as all hell.
So it could feel kind of like
Felt like if he was still in the mother, because I pushed down in the center of it and created a cocoon so he couldn't roll left and right and smother himself. That boy, first night we got 5 hours.
That's dope.
I'll never forget that. So, I would recommend to any parent. I mean, I should have go out and
they have
pretty
those.
much. They have those now. Mm-hmm. Yeah, there you have it. So I'm late at the game. I should have went and
we should have went to Shark Tank and should have got a patent and give a pitch.
On that one, yeah. But now, it was something that, because I was concerned about taking him out of that little bassinet, putting him next to us, and keep in mind, I made this damn thing under total. I don't know how I didn't salt my finger, to be honest.
You did what you had to do.
But I had to do exactly. I did what I had to do in order to get it. ADD and ADHD. Mm-hmm. Run it down to me. When kids.
So ADHD and ADD have been around for a long time. I remember.
Once again, that goes back into how people perceive kids or used to perceive kids.
Exactly. Mm-hmm. I remember a young boy in my second grade class who would always go get his pill. Mm. And when I got, I was like, he had ADHD. But he was a child who.
You went to a white school.
Right, he didn't look like me.
Of course.
Wait, this is my
because
point.
I'm trying to do her age, second grade. I'm collecting your age in second grade, and we weren't checking for that in the hood.
Right. But then, someone like my brother, who was the same way, rambunctious, they were saying that he had a behavioral issue. I think he probably had ADHD.
Probably did.
You know what I'm saying? But they kept wanting to send him home. So ADHD, for me, I'm so glad that we recognize that as a situation that is treatable, because in years past, children were just labeled as bad,
right,
or no good, they'll never learn, and they never were attended to in a way that would help them achieve educational success.
Right.
So now we know certain accommodations and stimulant pills will help people with ADHD. will help them to achieve. And I can tell you
When you
that,
say stimulants, so there's outside treatment as well, is what you're saying.
right, like Ritalin. But I have medical students and law students who are my patients who are on Ritalin.
Mm-hmm.
So it's not a bad thing. It's just that you can't pay attention.
Right. I just saw a commercial as recent as today where it was, of course, some law firm. If your kid had ate some baby food and have ADHD, there's now a big lawsuit out there now, a class action lawsuit towards ADHD.
Oh wow! I thought that was with the baby's gut having the
No.
Oh, okay.
I just saw it today. I was like, oh wow, good. I'm glad she's coming out. I got Dr. J on the show.
Heard that.
Yeah, that is the new one now. But then again, you got lawyers. They just hear two words and they're ready to go to court.
Look, I go to sleep here in Camp Lejeune. I'm like,
yeah, exactly.
If you were at Camp Lejeune, who was at Camp Lejeune? I said to my father, Dad, were you at Camp Lejeune? There's some money out there.
Yeah, tell my sons, listen.
Jay, were you at Camp Lejeune?
No.
Oh.
But I would tell my son, I've been at Fort Hood.
Mm.
And I want to tell you right now, anything happen, just remember you could collect. If you hear Camp Hood was a problem, same thing. Fort Hood was Camp Hood before it became Fort Hood. Just remember that. Same damn thing. Speaking with Dr. J, as I call her, Dr. Jackson, childhood diabetes in children we spoke on.
No, we didn't.
But please do.
Okay, so.
See, we've touched on so much stuff here already, you see?
Yeah.
I'm rolling with it in.
Juvenile diabetes is, for the most part, genetic.
Really?
Yeah, I love, and if you have,
Go ahead.
so when you have children, when you have someone who's diabetic and they were diabetic since they were like 4, 5, 6, 7, that's genetic. And so you want to make sure their kids, make sure you watch their kids because it's genetic. So when people say, oh, I have diabetes in my family, does my child have diabetes? Well, the people that got diabetes in your family, were they like older? Yeah. Were they overweight? Yeah. That's not the diabetes that your kid would get.
Whoa.
So
one or two? So
kids have diabetes. Well, children have type 1 and type 2.
Okay.
Type 1 is the one that's most, the genetic.
Big one.
Type 2.
Isn't that the one that you need insulin?
Type 1. Yeah. Type 1. Type 2 is usually overweight, weight gain, sedentary lifestyle. And when you're overweight, then your fat cells become insulin resistant. And so it's almost like your body is not breaking down what you're eating; it's just storing it.
Whoa!
So if you have a child
storing the fat,
okay, if you have a child that you start seeing putting on weight, should you be concerned about diabetes?
Especially if there are certain signs like the darkening of the neck.
Okay.
When you see somebody who's overweight, you look at their neck. If it looks like it's dirty, it's not. That's a rash that could mean pre-diabetes or diabetes. It could mean metabolic syndrome.
And that's 1 or 2. That's
two.
sign. That's sign of
2.
2. Okay. Now, there's also a digestive diabetes. Am I correct?
I don't know what that is.
Okay. I don't know. I've heard that term around.
I don't know that term. I'm sorry.
No, that's okay. You're the professional. You don't know. No.
Well, you might have read something I don't know.
No.
Might not be in kids.
Right. But diabetes, that's a big one in our community as well.
Yes.
And you just said that it is genetic.
Yes.
Now,
type 1 can be genetic.
Okay. Is it because a parent might have picked up is it in the blood itself, or is it something that's passed on? I know you said genetics.
It's in the gene.
It's in the gene itself. But can it be picked up that a parent is just cooking the way how they saw their parent cook, so their child got it? Type 2, I'm talking about.
Type 2. Yeah.
That is
if
possible.
If they're not eating well and they're sedentary and, gaining weight.
You see, the reason why I picked them, why I'm very much on top of that is because in our community, a lot of parents, young parents in particular, don't go for dietitians, kind of like advice.
Mhm.
Would you recommend that?
I recommend that to anyone who is unsure of how to eat. Yeah, sure, why not? A nutritionist can help you,
Hmm.
understand how to eat carbs in a healthy way.
Hmm.
How to eat proteins in a healthy way. Because I believe
Hmm.
we have teeth to
Right.
eat everything. We grind, we chew, we
Mhm.
masticate, meaning that we break it up with these teeth. So we hear people, I don't want to eat meat, I just want to eat vegetables. Wow,
Is that a good thing?
depends. Like I know I have a friend, I've gone out with her before, and she's a vegetarian, and she orders a double order of fries and 2 grilled cheeses. Now that's not healthy.
Right.
So any way that you choose to eat, you need to understand how to be balanced and how to get what you need.
I tried being a vegetarian. I really did. I tried. Yeah, I was dating this chick back in the day. She was a vegetarian, which pretty much means I was a vegetarian. But
For what though?
was that?
For what?
No,
Although
that ain't why we broke up. By the way, we broke up because for many other for total different reasons. But
It was the steak you brought for dinner one time.
I
She's
wish
like,
I
how
could have
could
just
you?
said, yeah,
How could you?
yeah. How could you break a steak? Because I want
know.
to break up. That's why.
Yeah, right.
I mean, I think now that
There you go. How to break up with a vegetarian? Show up with me. Go ahead.
I mean, the FDA just approved lab grown meat. That's a problem for me. I don't
Yeah,
want
I
lab
saw
grown
that.
meat.
What is
Who
this?
wants that?
I don't know. I just recently I just went with somebody and bought a cow. So, yes, and I'm gonna have.
You're just gonna have one meal.
I'm gonna have.
You got one cow.
beef. So we got 4 people. I got a quarter of a cow.
Okay,
So I'm
but
gonna have
that's
that.
one. But how long is
That's
that gonna last?
A long time because then we're
What's a
gonna get
long
a pig.
time?
That's gonna last.
You're gonna get a pig?
I'm gonna get a pig too.
Okay, all right. She going for
So,
that poke. Go
it's like a
ahead.
year.
The other white meat. Go ahead.
It's gonna last about a year.
One cow?
A quarter because I don't eat. We don't eat. We are not gluttonous for meat,
Mhm.
right?
You never had some good ribs.
Oh, I love ribs, but I'm not gonna eat I'm gonna eat 2, right? Plus I'm gonna have a
2 rib?
with a nice veggie, a nice carb. Come on, that's how I eat that way. Although I don't look like I do, but
Stop with it.
but
She goes out extra on it. What's wrong with you? Look great. Continue.
but what I'm saying is that a quarter of a cow and a half a pig is gonna last me a year.
That would last me 2 weeks.
No, it's a lot of meat.
Crank up the grill.
It's a lot of meat.
You know what my thing is? Once I have that much food around, I have a need to have people over. I don't know what it is. It's like, you know what? Yeah, we have this. It's gonna spoil. I don't know. Because I don't have a deep freezer.
No.
I take it you do.
Because I get a meat service now. Anyway, I have an organic meat service.
Oh, is that right? Look at her go. Ear infections. Let's talk about that in young ones.
Ear infections. So, the eustachian tubes are what lead from your throat to behind your eardrum, right?
Okay.
And in babies, they're like this. In adults, they're like this. So you
Okay.
see how
So
there's
one is horizontal, one is vertical.
yeah, theirs is horizontal, so it doesn't really drain well.
Right.
They have adenoids that block block it from draining. So there's
They have a what? They have what?
adenoids.
What's
They're just tissue that's all the way in the back of your throat.
okay?
So
Just throw medical terms
so
like we
kids-
all gonna know exactly what the hell it is. Come on. I'm
so
a grown
kids are
adult.
just physically set up to have ear infections if it's the right situation. A cold with a lot of mucus,
Mhm.
laying down, drinking the bottle laying down. And if any fluid gets behind the eardrum, it's not going to be able to come out readily, right?
Oh,
So it'll sit there and it'll get infected, and that's what causes an ear infection.
So as you get older, it eventually just drops.
Starts to go like that.
It starts dropping, and that's a natural thing. So with the
Adults rarely get ear infections
right,
like that.
right. So okay, ear infections with kids, signs of it.
Irritability, touching the ear, fever, restless sleep,
Mm-hmm. Restless sleep.
pink eye.
Kids, babies get what age does pink eye start showing up in kids?
It's just an infection of your eye. Anybody
know.
can get it.
I know it's just an infection, but at
Anybody,
any age.
Any age.
Wow, I didn't know this.
But at different ages, it's caused by different things.
Hmm.
Mm.
How does a parent deal with a heart condition of a child? Child with heart
Have a good
condition.
cardiologist.
Is that right?
Hmm.
Is that the only way out?
Yes, if your child has a heart condition, you have to have a pediatric cardiologist.
Okay. All of this stuff that we talk about, all of these ailments
Hmm.
comes with a cost.
Hmm.
Insurance, we
Mhm.
now know it's mandatory. Uh, I'm so concerned about parents who feel like they can't afford to take care of their kids.
Well, in Connecticut,
Mm-hmm.
we are so kid friendly
Mm-hmm.
that Husky is almost, if you're underinsured or you don't have insurance,
Mm-hmm.
most of the time your kids will be covered by Husky.
Is that right?
Husky is so inclusive; it covers Tylenol.
Hmm.
If you have Husky, you have a damn good insurance. And we need to thank our former Senator Tony Hart for that.
Former
Husky.
mayor, and of course when she was senator,
Uh-huh.
she did a lot for kids. She did a lot for.
For Connecticut.
Thank you. She did do a lot for Connecticut.
Hmm.
But we can continue on that. Since you deal with kids up to 22, young people, I call them kids, it's young adults, STDs. Talk to me about that. Because,
So-
some kids are not going to want to, especially girls, I would think, don't want to tell their parents what it is that they
So-
have signs of.
Right. Yeah. So we know that teenagers are, they have high risk sexual practices.
Mhm.
And the big thing is that chlamydia, which causes sterilization of women, has no symptoms.
Mm.
So, and it's rampant. And chlamydia sterilizes girls. It doesn't sterilize the men, but it sterilizes girls because it scars the tubes.
Oh, okay. The
fallopian tube. So that's why when teenagers get physicals, their urine is sent for GC and chlamydia, because
it's no way to tell if it just by no discharge anything to that.
Not
nature.
for chlamydia.
Okay.
Gonorrhea is the drip, green drip
Yeah.
burn.
Whoa.
Green drip burn.
Whoa.
Lot of mercy.
Yeah,
No.
that's what I.
Woof.
I need to make an
Like,
emergency
who gets that?
call, not a
Yeah.
special call.
Who gets that anymore? You know what I mean? But there are people who get it still.
Wow.
Because they're like really high risk sexual practices. This generation doesn't feel like they should, save something for later. They're like,
Just make it happen.
yeah.
Ouch.
Uh,
So, and do you see, so sexual diseases, STDs are high?
Chlamydia, because chlamydia is, so you can walk around chlamydia for a very long time because
What's
it's
a long time?
a year.
And then all of a sudden, what happens?
Nothing. You go get a urine. You go to a physical and someone checks your urine.
If it's not detected in about a year.
For a woman, it can cause sterility.
I understand, but help me understand. It does that, but how? Since it's not, it just
So
don't show
that
some sort of
bacteria is-
sign.
The
So-
bacteria is just causing inflammation inside.
Guess
of
what
you.
I'm asking is it something that you would recommend annually in a kid's checkup?
At New Haven Pediatrics,
Mm-hmm.
from 13 to 15,
Mm-hmm.
I would say 13 and 14, high risk kids that you know.
Mm-hmm. 13 to
But-
14
But 15 and up, you're getting a urine sent for STDs.
annually.
Mhm.
Okay, that's good. Because you want to make sure that now, as you say,
Because you want
scars-
to treat boys. Because
Right.
you don't want boys infecting
give
the
it to girls,
girls, and
right.
then the sterility. And we all know. We all know that we need to watch fertility rates for one.
Mhm.
And I just read something where they're looking at men's fertility, saying that sperm counts are going down.
something in the food. I don't know.
Look,
But here's the thing, because I'm glad to know that you check this annually. This is a practice of yours to check annually
Right.
once you're a certain age,
mhm.
especially if the kid lets you know that they're sexually active
Or
You,
not.
or not. Yeah, you let them know. Okay, I'm going to do this check. That's very important because, as you said, now it can stop a a young lady or even further on in her life from having kids.
Hmm.
And have this always been a thing, or it's just now that because we're knowing more about these diseases, modern medicine has put us more informed? Is it that what it is? Because so many women that I know who just hell, a lot of them in my age that never had kids, and I know
So
some of them are by choice. I know a few of them who are by choice, because, or at least that's what they say, But I don't know.
when you know better, you do better, right?
Okay.
And when we
Or you
want
should do better.
and when we want to, and as a physician, as you know that chlamydia doesn't have any symptoms, you're going to test for it.
Hmm.
I'm going to give you an example, and I will never forget this because there's always things that happen in medicine that stay in your mind and they actually really frame and inform how you practice.
Hmm.
I was in the ER at St. Ray's, and a young lady comes in and she's doubled over, and her parents are like, "Yeah, she ate Kentucky Fried Chicken last night, and she's been sick ever since."
Mm.
And I was like, she's here with her mother and her father. She looks fine. This girl's got to be food poisoning. So, but we had to make sure it wasn't the appendix. So we call surgery down, and the surgical resident comes down. And he's like, "Did you do a pelvic to make sure this is not an STD?" I'm like, "This girl doesn't have an STD. She's in there with both her parents. She's, in high school, doing fine, cheerleader, blah, blah, blah." And I said, "I'm not doing that." He's like, "Well, I'll talk to the parents." I was like, "Go right ahead. I'm not doing it." She wound up having disseminated gonorrhea in her abdomen
Mm.
in the hospital. And it taught me a lesson.
Mm.
I did what I accuse certain people of doing all the time. I judged a book by its cover.
Hmm.
And I said, but after that, all teenagers got it. I'm gonna send their urine out.
Yeah.
That was when I didn't have my practice. I was like, when I have my practice, I'm gonna make sure that after a certain age, I'm just sending it out.
Mm.
And I'm gonna make sure I talk to these kids in private so they can be honest with me.
So is it a hygiene thing? Like if a man passes on like gonorrhea and all these things, is it a hygiene thing? Is it because they're not cleaning, or is it because even after sex they're like?
It is a nasty thing because you're just going around having sex with people without protection.
Okay.
You could clean all you want. If the bacteria comes in contact with your pee hole, it's gonna climb up.
Okay.
They have arms and legs.
So
Okay.
someone in the mix is not showering. That's just what I want to get to.
No,
that's not what
Nothing
it is.
it is. All right, cool.
It's just
But
if the bacteria get to the hole, the thing have a Ferrari engine in it.
Yeah.
It's going up.
But
Gotcha.
not cleaning may spread crabs.
Ooh.
Hey.
So it's just a bacteria that just developed.
Here's another thing. Crabs. Is this because
Body louse. It's a body louse.
body louse, but it's usually from areas that have hair. Because there are some people who believe if they shave down there, there's no crabs.
No, that's lice. Lice and crabs are two different things.
Oh, okay.
Mm.
The louse that's down in your privates is crabs.
Hey.
The louse that's on your body is just like body louse.
Okay. So the crabs are just like crabs.
They're little flat things, and when you go there, their legs go up. They're disgusting.
Whoa.
They're pretty nasty.
Oh my goodness.
Here I am
my
in my
God.
life, I gotta thank God. I'm knocking on wood. I gotta tell you, if it's anything I can say that marriage did for me, it kept me out of that lane. Woo!
Oh my
Oh
God.
my! If it's anything.
Sick, right?
I thank you so much for coming in and
Strap
discussing
up.
all of this. Yeah, not strap
Strap
up.
up.
Like,
Wash up.
exactly.
Wash up, strap up. I mean, washing up can't
Wrap
save
up.
you from gonorrhea, but
And you know what else
Jesus.
I can't? If you can wear a condom all you want. If somebody has a syphilis sore on them,
Oh.
could be on the pubic area, but
Yeah.
not on the penis part.
Yeah.
Or not on the inside of the vagina. It's on the
Yeah.
outside.
Oh.
You're catching it.
if a female rubs against it.
Right.
I
If
just
there's a wart there
Yeah.
and you rub on it, you're catching it.
I'm trying
Oh.
to wrap my head of the source. Like, where does the bacteria
The
start?
Hold on. This is important.
The
For
wart.
the wart, if you rub up on the wart, you're gonna catch it.
Ooh.
So
It doesn't have to be on your privates. It could be like just above where the condom isn't, right?
Oh.
Or what if they have it on their hands?
Oh.
Oh.
That makes sense. Yeah.
Oh,
They got-
and then that's
they got
called
the
what,
wa-
what's that? General Ward Sager.
Yeah.
I used to
Oh.
see
They got
those
the
commercials.
wart
Those
on
are
their
gone.
Oh
Oh,
my
no.
god.
We're still giving that
Yeah.
because it's and the cervical cancer rates have gone down because we're vaccinating the boys and the girls
For wards.
for the HPV,
Oh my goodness.
Well, HPV. What the hell?
human papillomavirus.
Okay, didn't know what the heck it is, and that's called a ward.
Mhm.
Okay, all right.
Well,
I got to thank you so much for coming in, Dr. Tamiko Jackson, hanging out with us, keeping it ugly with us, covering all of these illnesses that are in our community. Stay healthy out there, people. That's all I can tell you. Try to stay healthy. How's that?
Inspect.
Inspect. Inspect. Re-inspect. First be suspect.
yup.
After being suspect,
Yup.
inspect, and then make sure something, everything is all.
I need to
is
stop playing.
You might need to reject.
Yo, facts.
Or
Facts.
eject.
Yo, facts.
Thank you so much for coming in with having this with us, Dr. Jackson, Dr. Tamiko Jackson. Let them know where they can get in contact with you.
New
By the
Haven,
way, are you taking new patients?
absolutely. New Haven Pediatrics, 419 Whaley Avenue, New Haven, Connecticut, in the heart of the city on Whaley Avenue, right diagonally from Walgreens, 203-752-0706. Tell them Dr. J sent you.
Dr. J herself, that's my sis. I'm going to just say it out loud. This is my sister. All right, keep it ugly, people.